Hello, everyone. Welcome. My name is Ryan. Today, we're going to do a quick Facebook Live today to try to better help you guys. Again, I'm owner and founder of Natural Fit Therapy. And here at Natural Fit Therapy, we help people stay healthy, active, and independent. We help people prepare for and enjoy an active retirement life. And recently, we've really picked up the speed in this group to try to help people stay active and independent. And we really are trying to serve you guys to be able to enjoy retirement, an active retirement, not the stereotypical just sit back, relax, and rest. We want to help people travel, hike, bike, golf, and one of those things is we feel like people don't have someone to be active with, right? So we have helped create at least some meetup groups for hiking mainly right now, and we're going to add to those in the future. And today, um, we're going to talk about one of the other things that people tend to have trouble being active, right? So the first one that we found, at least when polling our audience, is that people don't have someone to be active with, or they don't have a schedule or an event or something that's convenient for them. Number two is people have aches or pains, or they know they need to get stronger. They know they need to work on certain things, and they're not sure where to start, right? They're not sure if they want to go to a personal trainer. Go to a chiropractor? Do I go to a physical therapist? And today I want to help you make a decision on how to choose a physical therapist. This is in no means meant to be a promotional video for natural fit therapy, but we realize that our viewers are all over Austin. Not all people are going to be willing or wanting to come to North Austin. We realize that we have viewers outside of Austin and maybe across the country that have shared into this group just to get the helpful tips and advice. So we're going to talk about today the three things that you should consider if you're looking for a physical therapist. And there's lots of different things a physical therapist can help with, but I would say that the main things, if I were to kind of group them into a bucket, are they can help with pain related issues: neck pain, shoulder pain, back pain, knee pain, hip pain, any of that. We can look at the body as a whole and figure out why you're having the pain, and we can create a customized plan to be able to reduce you out of pain. However, not all physical therapy is created equal. And we have heard so many stories, and so many people have been frustrated because they go to a lower quality or less experienced physical therapy clinic. And we're going to talk about what to look for and how to find a clinic that works best for you. However, we have so many people that they'll come to us and they'll say, you know what, I've tried physical therapy and it didn't work, right? And so that just eats at me deep inside because I know it works. I know I help hundreds of people on a regular basis. And there's a specific uh, way to figure out if your physical therapist is the right fit for you, right? So I've been a physical therapist for 11 years now, and I've worked in a busy orthopedic clinic. I've worked in home health. I've done some time, short periods in skilled nursing facilities and in hospitals. So I have a good idea of how this all works. And 5 years ago, almost 5 years ago, I started natural fit therapy because I was burnt out and didn't know how to really help people to their best ability. And so I decided I would create natural fit therapy. And there's a lot of other good clinics out there that have similar qualities. And I just want to share, how do you figure out what is a good physical therapy clinic? So the three things we're going to talk about today is the training of the physical therapist. We're going to talk about treatment setup, or maybe the business model, and what some clinics are set up in a way that isn't conducive for helping people stay active and really manage their issues. And the third is some financial considerations, right? And we'll talk about some of the pros and cons of the different clinics with regard to finances. All right, so the first one we're going to talk about is training of the physical therapist. Um, this is not, you have to put all these factors together to figure out what is the best clinic for you. However, you want to look for a clinic, preferably with a doctorate level training therapist, right? Now, don't get me wrong, there are still plenty of therapists that have been treating for a long time and have stayed up with the education and have more experience. And just because they don't have a doctorate doesn't mean they're not qualified. However, it does help you as a consumer try to figure out who has a little bit of extra training, and the difference between a master's and a doctorate level is an extra year of schooling with emphasis on things like differential diagnosis, knowing exactly what's going on with you, and then knowing some of the other red flags that would require us to refer out. The second thing is you want to look for specific training in the areas that you're having difficulty with, right? So if you have an orthopedic issue, if you have aches and pains, if you have shoulder pain, back pain, knee pain, sciatica, things like that, you're going to want to work with someone that has an orthopedic background, right? And orthopedic means, to simplify it, bones, muscles, joints, right? You want someone that is regularly working with that type of population, right? And so there are things that you can look for. Is there's different certifications that show that someone has been working in that situation for a long time. So just ask these questions when you call up to your physical therapy clinics and ask, do you guys work with orthopedic issues? Um, yeah, I have a question here that explain a board certified neurological physical therapist. Yes. Roger, thank you. I will get to that in a second. So the next thing that you want to look for is, for example, uh, if you have orthopedic issues, you want an orthopedic therapist, right? If you have neurological issues, so you have Parkinson's, you've had a stroke, maybe you have MS, you want someone that is specialized in working with that. So there are, through the American Physical Therapy Association, there are extra board certifications that can be obtained by a physical therapist, right? And one of those is board certified neurological physical therapist, right? And so if you have Parkinson's or have had a stroke or have a neurological condition, this is a great way to know if someone has extra training. It doesn't mean that someone that doesn't have it doesn't have the skill sets. It's just an easy way for you to screen people out, right? So you have to be a licensed PT to be able to get this board certified neurological physical therapist, and you'll see an NCS after the name if you see that. They have to have 2,000 additional hours of work with neurological populations, right? So you have to work for a while with this type of population before you can get that credential. You also have to pass a rigorous neurological clinical specialist exam, right? So there is a book section where you have to do question and answers, much like the general board to become a physical therapist, but this is very specific to neurological populations. Um, and there is a clinical skills section as well. So they actually have this in sports physical therapy. So if you are a athlete, college athlete, high school athlete, there are some therapists that have a SCS. There is an OCS, which is orthopedic clinical specialist. There is a women's health specialist. So if you have pelvic floor issues or incontinence issues, that is something you want to look for. The other thing is, addition to the board specialist, there's lots of certifications that PTs can take to specialize. So back to Parkinson's, there is Power for Parkinson's certification. There is LSVT Big. So here at Natural Fit Therapy, we have a couple therapists that are LSVT Big certified, and we have one therapist that is Power for Parkinson's certified. Similar certifications that kind of have slight nuances different, but both are very well equipped to help people with Parkinson's. You also want to make sure, in my belief, some type of hands-on therapy is going to be super beneficial, right? And when we talk about the business model, that doesn't always allow for hands-on therapy at some of the other clinics. So if you have a neurological condition, you need to have your therapist there to be able to cue you and correct you and make sure that you're doing the things you're supposed to be doing. If you have an orthopedic issue, manual therapy has been shown in the research to really help reduce pain and help improve the in combination with exercise to really help um, with those orthopedic issues, those back pain, sciatica, shoulder pain. Um, yeah, Roger, thank you for sharing. I see that Roger writes that he has Parkinson's, had a stroke, and a TIA. Right, so someone who is LSVT Big certified, or someone who is Power for Parkinson's certified, or someone that has an NCS would all be good options for you. And something like those neurological conditions, you want to make sure that you do regular check-ins with your therapist. Think of this person as your provider and at least see them for a section of therapy at least once a year. These are things that we know they're chronic conditions. We know that Parkinson's is something that sticks around for a while, and you can control symptoms and you can make a difference in your day-to-day life, and you can decrease the progression of the symptoms by doing regular intense exercise. And so having someone help you through that process and knowing how to work with your specific condition can be super helpful. Um, the other things to consider is, do the therapists or the place that you're going to regularly work with older adults? There are concepts that flow between the different settings. Obviously, it makes sense that you're not going to treat a college athlete or a high school athlete exactly like someone that is 50 plus or someone that is 60 or 70, right? So making sure that the place you work at is used to working with your conditions, right? If the clinic that you go to has a bunch of athletes and people that are doing things that you have no intentions of doing, you want to make sure that they're used to dealing with the intricacies that happen as you age. The aging process is there's a lot of things that pop up, right? You have multiple conditions, multiple injuries, and it really helps if you have a clinic that is used to working with people of your age. The other thing is vestibular imbalance. We do a lot of vestibular imbalance. So we do a lot of fall prevention. We do a lot of vertigo. We do a lot of dizziness. We work with people that want to prevent having a fall, are feeling a little unsteady on their feet, and they want to get stronger and more balanced and more confident to go out and do the things that they want to be able to do. This is not a general high volume clinic that is going to be able to give you the best care to be able to overcome those issues. And then I mentioned it before, women's health, right? So after pregnancy, if you have pelvic floor issues, diastasis recti, different things like that, you're going to want a women's health specialist. We don't do that here at Natural Fit Therapy, and there's a few places that we would be happy to recommend you to go see. But that's why it makes you have to do your homework and make sure that you're going to a place that's specific for you. So that kind of wraps up training of the therapist. Make sure you ask questions about the therapist, what they're training. At least make sure they have a mentor or someone on site that is helping them to improve their clinical skills. Number two is treatment setup, or what does the business model look like, right? So sadly enough, we know that insurance um, dictates the level of care at most PT clinics, right? So a lot of places create a contract with the insurance company based on just trying to be able to get their patients in the door. And what happens is they reduce the amount that they'll pay for the therapy to be able to be in network, right? And so it's kind of a deal basically. I'll go, if you allow me to be in your network, I'll take less pay for it, right? And before, things used to work great. The therapist could make a decent living, and we saw lots of people come in, use their insurance. However, insurance reimbursement is dropping significantly, and it's been a trend for the last 15 years, and it continues to move in this direction. Medicare is reducing, United Healthcare, Humana, they're all reducing how much they pay for physical therapy. And so, what a lot of clinics have started doing is they see more patients at the same time, right? So, where they used to see one patient an hour, maybe 7 or 8 in a day, it used to be very typical 15 years ago. And even when I came out as a new graduate, there were still plenty of places that being are treating one-on-one. That is becoming more and more rare. So what people will do is says, okay, well, if you're going to pay me less as an insurance company, I I feel like people are going to want to use their insurance. They're going to want to use in-network benefits. And so what I'll do is I'll see 2 or 3 or 4 patients in the same hour to be able to make it financially. And so what that means is you don't get one-on-one attention. Most of the time you go in, you see your physical therapist. They'll actually, you'll see like an aid first, and most of the time they'll start you on some kind of passive modality, right? You'll lay there on a hot pack under e-stim, or they'll put you on a bike and leave you by yourself for 10 minutes, right? Your therapist will come check on you. If you're lucky, they'll do a little bit of hands-on, they'll do a little coaching, they'll do a little bit of one-on time, and then they pass you off to, most of the time, a high school graduate who wants to go into physical therapy school, who's going to now monitor you through the rest of your treatment session, right? And I'm not saying that's wrong. It's just, in a lot of cases, not the best way to get your physical therapy. So trying to find a place that is one-on-one, so you work with your licensed physical therapist, whether it's a licensed physical therapy assistant, or if it's a doctor of physical therapy, or even a master's of physical therapy, your one-on-one can make a big difference in the quality of care that you're getting. The second thing is hands-on. I mentioned this before, is having hands-on is shown in the research to really be a great adjunct to any of the other things that we do, mainly exercises. But it's very important to have the time to be able to do hands-on. In those busy orthopedic clinics, they don't have time, and so they end up doing more exercise-based stuff because that's more likely to be able to have someone watch you do that versus actually have the therapist work with you one-on-one. The other thing is modalities. A lot of places do passive modalities, right? And the research is very clear that you have to be active in your rehab. You can't just lie there and have someone fix you, right? So, although manual therapy is somewhat passive, there's lots of ways that needs to be included into an active program. So, lying down on a hot pack with e-stim, or ultrasound, or traction, or iontophoresis, or diathermy, or these passive modalities. They're gadgets and they seem cool. They do help with some pain relief. However, there are better, faster ways to reduce that pain and to get you active than to lay on a table for 15 minutes with electrodes on your back. And if that feels really good, there's no reason why you can't get a home TENS unit and do that. The reason places do that is because they can charge the insurance more for doing that, and it doesn't require any more manpower. You can lay there on the table and they can put those electrodes on you, and they can get an extra $10, $20 from the insurance company, right? So It's not that it doesn't work. There's just better things you can do during your time, and things that are going to be long-term solutions versus just treating the symptoms temporarily, right? And so a lot of places that do one-on-one don't do as many modalities. They do more one-on-one therapist interventions rather than these old school kind of gadgets that have shown in the research to be very limited in their effectiveness. So number 3 is financial considerations, and I'll try not to make this run out too long, but I think it's very important to consider the financial component to therapy because, or any healthcare for that matter. So one, I would say wherever you go needs to be transparent about their prices. They need to be able to um, communicate how much it will cost to you before you sign up, right? Because how else can you make? Nobody likes surprise bills. No one wants to be, you know, 6 weeks into a therapy plan, and then all of a sudden, here's this giant bill in the mail. We don't want that. So I think it's only right and ethical to have a conversation up front of how much it's going to cost so that there's no surprises. So um, I'll preface what I'm going to say next is cheaper isn't always better, right? And I can give you a couple examples of this, but there's pros and cons of using your insurance or going to an in-network clinic versus an out-of-network clinic, right? So in an in-network clinic, the thing is, most insurances, you'll have to pay less, right? You may have a smaller copay or you may have a smaller deductible, right? Which is why they try to encourage you to go to in-network clinics because the insurance already has a negotiated lower rate, knowing that they're going to save money if you go to an in-network. Does not mean the care is going to be as good. And in fact, most times in-network care is not as specialized and not as individualized and doesn't get outcomes as quickly, right? So most of the in-network clinics we talked about before will see 2, 3, sometimes 4 patients an hour, and so you're getting less one-on-one time or shorter visits, right? So a lot of places that are in network, they, especially if you have Medicare, they don't, Medicare requires you to be one-on-one. However, a lot of places get away with it because they'll schedule you one-on-one while one of the um, alongside with someone who has just commercial insurance. So whenever they look at the charts, they won't see that you're not one-on-one. There's a lot of tricky games that people play out there, right? Or what a lot of people do is they'll just see people, their Medicare patients for less visits, right? Or less time. They only do 30-minute sessions because they got to move on to the next person that they can see 2 and 3 an hour at the same time, right? Or they say, you know what? Medicare, we have to see them, but because we can't see them 2 or 3 at a time, we're going to limit them very quickly to only 12 visits or only 10 visits, right? And I won't get into the therapy cap and the threshold today. That's for a different topic. But a lot of places will limit how many visits you can have, right? Because they'd rather, get you a little band-aid and then move on so that they can see more of the commercial insurances that they can see 2 and 3 an hour, right? So a lot of times you end up having more visits and taking longer to get the result that you're looking for, which could in turn end up in more money in the long term, right? So I'm going to give you a completely non-therapy example of this that happened to me recently. So we're currently doing a remodel of our kitchen, and we shopped around and we got a few quotes, and we did decide on someone that was in the middle of the road, a little bit cheaper than the other quotes that we saw. And now we have they redid the ceiling, they took out a wall, they put in a beam, it looks wonderful, right? Well, a month later, we start getting cracking in the drywall in the ceiling, right? So because we didn't go with quality, we ended up losing out on time, right? So luckily, they did it right. They came back, they redid it, and it looks fine now. However, that's more stress on us. That's more coordination with the company, and there's just more stress and headache. So the way this relates to physical therapy is if you're going to a in-network clinic and you're getting, let's say, mediocre care, and it takes you longer to get better, and what happens if you don't actually get the results, right? What if you go to another clinic and that one-on-one for 15 minutes isn't enough to actually solve your problem? Then you end up having to look for another person. So what if my contractor said, nope, that's what you paid for, that's what you're getting, and I had to now go find another contractor to fix the problem? That would be a lot more money out of my pocket, right? And so it's not always about money. A lot of times it's about time, right? So if you can get quality over quantity, then you're going to get to your results faster, and you're going to be more certain that you're getting the best care, right? Um, I think most people would agree that having one on one time is going to be able to give you a better outcome. And if you do 30-minute sessions, it's going to be less effective than hour sessions, right? So something to consider. Um, the next point we have is don't forget about your HSAs and your FSAs, right? So these are employer, most of the time through your work, right? An HSA is a health savings account. And this is something that stays with you, whether you change jobs and you can keep it and it stays in there, but you can use it for qualified medical expenses. And a lot of people forget about physical therapy as a qualified medical expense. So if you have an HSA, you're already putting tax-free money away in this HSA for this particular reason. It is for investing in your health. You're taking the time doing smart financial decisions to put money into an HSA, whether your employer matches it or not. That money is there for you to use on you and your health. So, what better way to do that than to help you stay active and independent and make sure that you're preparing and enjoying your retirement? There is FSAs, and I'm not going to go into too much detail because we do have a blog, and we're going to go ahead and drop that down in the comments. But basically, it goes into more detail about using HSAs and FSA for physical therapy. So an FSA is a savings account where it's use it or lose it, right? So you have it, you have so much money to use by the end of the year, and once January 1st rolls around, you either use it or lose it. So this is a great, if you have an FSA money left over at the end of the year, you're just getting rid of it, right? And so why not come in and get one of those aches and pains? Thank you, Sarah, for putting that in the comments. If you have aches and pains, or you have an issue, or you need a tune-up, or you haven't, you feel like you're slowing down or not being able to do everything that you want to be able to do, well, let's use that FSA before it goes to waste. The last thing that we're going to talk about briefly is just a few things with Medicare, right? So there is a limit on how much Medicare is willing to pay per session. And there's also a lot of rules and regulations of how many visits you can get a year. Now, this is a very gray area, and some clinics are very strict. Like I said, they'll only see 10 visits, that's all you get. And some places are a little bit in the middle, and they kind of extend a little bit past that threshold. However, there reaches a point where um, there's only so much that the insurance is going to pay for. And a lot of people think that's it. They just get kicked out the door. Sorry, your insurance isn't paying anymore. There's no more options, right? So find a place that has options for you to continue, maybe on a private pay basis or on a wellness basis, right? So here at Natural Fit Therapy, we have a wellness program that people continue with after receiving their therapy to maintain what they gained in therapy and to make further improvements. Because honestly, Medicare wants you to get 80% better. They want you to get just good enough. They're more worried about keeping you out of the hospital so they don't have to pay a large hospital bill. They don't care if you have goals of staying active and independent and you want to go golfing and you want to go traveling and you want to do all that stuff, right? that's more recreation in their eyes. They want to make sure that you can just do your day-to-day activities, right? And so there becomes a limit. And for me, I don't want to let someone else tell me what my potential is, right? And so there needs to be options of continuing, whether it's a maintenance program or a wellness program or private pay program, to continue to improve on what you've done so well in therapy to improve on. My last point in here I kind of covered earlier, but they're getting lower and lower reimbursement for insurance companies, right? Including Medicare. And when Medicare makes a change, all the other insurances make their change, right? And at some point, when I started natural fit therapy, I made the decision that I am not going to sacrifice quality just because of what the insurance is saying, right? I'm not going to see 2, 3, 4 an hour, right? We're just not going to do it. And so what that means is that's why we're out of network, and that's why we are still able to see people one-on-one. So there's still a lot of people that use their insurance benefits. A lot of people get most or all of their treatments covered. However, like we said, we'll be very transparent of the price, and you'll know exactly what you're getting into before you come. So be sure to ask questions. Ask your therapist before you go in, how long will I get one-on-one with my therapist? How many other patients are there at the same time? Do you do hands-on treatment? Do you have a certification in what I'm trying to get treatment for? And if you forget, cheaper isn't always better. And don't forget about your HSA plans. So hopefully that helped you figure out, what to do when you're looking for a physical therapist. Please, if you found this was helpful, please share it. It will be posted in the group after this. Please share, like, comment, let us know what you thought. Maybe share some experiences where you had some not great therapy at one of the in-network clinics. We'd love to hear your stories. We'd love to hear if you guys felt this was helpful. If you feel like after today you have a good idea of what you're looking for, and you're interested in getting help with natural fit therapy, we do have what we call discovery sessions, and these are free consultations just to help you better figure out if we're the right fit for you. So all those questions I told you to ask, a lot of times it's hard to get those through to the receptionist. Right? So we actually have a free session where you can sit down with one of our doctors of physical therapy and you can ask all these questions before payment, before talking about insurance, and you can figure out if this is the right fit for you. So if you're interested in one of those free discovery sessions, go to naturalfittherapy.com/keepaustinactive. I'm going to go ahead and put it in here. naturalfittherapy.com/keepaustinactive. Awesome, Roger. Thanks for joining us. If please share this, and we will have this recorded. Oh, look at that, Sarah! I beat you. She's trying to help me out, and we double posted that. So yeah, go to Keep Austin Active, naturalfittherapy.com/Keep Austin Active, and you can sign up for your free discovery session. If you have any questions or comments, shoot them below. We're always happy to help. As always, try to stay active, be safe out there, and if you need anything, we're always here to help. Thank you, and have a great rest of your week.